So today we have this long-term mule. Her name is Raven, and we have been working on Raven for quite a bit. We have always treated Raven like she was an athlete, and today is no exception. She is actually 22 years old now, and she's starting to develop a little bit of arthritis on the hind fetlocks. So what we're gonna do is we are going to put a low dose of cortisone with some hyaluronic acid and some antibiotics to prevent infection in the fetlocks and the hocks as well. Hyaluronic acid. She has fetlock pain and is developing pain in the hind fetlocks with quite a bit of inflammation. So what we're going to do is we're going to put a very low dose of cortisone to decrease the pain and a very low dose of antibiotics to make sure she doesn't get an infection. And I'm also going to put hyaluronic acid. So mules, just like donkeys and horses, also get arthritis, and we treated them just like if we were treating any athletes. The use of cortisone in horses is actually going significantly down, rightfully so, because back in the day, veterinarians used to abuse the use of cortisone. And now we have found out that cortisone could have some detrimental effect on the joint of horses and people as well. But one of the things I like about it, if I use it in low dose, I actually see a very good significant effect quite quickly. And I try not to get in that joint again with cortisone for the next 8 to 12 months. If we have to go in again, then I will automatically recommend regenerative treatments such as alpha-2M, PRP, amnion, other type of treatments, not the cortisone, because in the long run we have found out that the cortisone could have some detrimental effect, but anything used with caution could be quite beneficial. So some of you might ask, okay, which cortisone you're using? So in this particular horse, I'm using beta-metazone. And just in the lower hog joints, only in the lower hog joints, I'm gonna put methylprednisolone acetate. We call it depot around here. Just in the lower hog joint, because we think has quite a bit of detrimental effects on the cartilage. In the hog, it's quite beneficial and it doesn't have that big detrimental effect. So we're doing this very aseptic. Gonna come here, and right there I'm in the joint. I can feel it. I see a little drop of fluid, and I go and inject, and it's over. So it's the tarsal joint. I draw a horizontal line between the spleen bone and the extensor tendon, right lateral to the extensor tendon. Look at all that fluid. You see all that fluid? That means there's quite a bit of inflammation in that joint, and I'm gonna go in and inject it. You see how it's coming back? The needle, the plunge is actually coming back because there's pressure in the joint, pushing that plunger back. So we're doing some good today. I'm gonna go right in, and I'm going right into the joint just like that. Attach and push. Tarsometatarsal joint. I'm gonna go right above the splint through a ligament, and I'm gonna hit it just like that, right there. See some horses or mules and kick. Very important to be safe. Right there. You see the fluid? I'm in the right place. Fluid is there. I attach. I'm careful. And I inject. That's what happens when you work with mules. Good. So we're gonna go do the horizontal line between my other injection and the extensor tendon right above my thumb. 1, 2, 3. And right there, we can redirect, and right there, I'm in the joint. We can see that it communicated actually, and high percentage of them will communicate. And that's it. We're done. Hocks injected. Now Raven is gonna go home. The owner is gonna remove the bandage tonight. Very important, she remove it tonight. Clean it. And in about 3 days, she's gonna start riding back to work.